Hello, everybody. Muchas gracias por venir. Welcome to all the students and friends and professors, and welcome to the second episode of Career Night series. We are delighted to introduce you to Kurt Keene, who was our student in the actually double major in linguistics and Spanish. He also was a student in the master for communication science and disorders. And he was one of the recipients of the undergraduate Conrad Smith Award. So we are very happy to be able to talk to him about the job opportunities in the field of speech pathology in Spanish, which is a field that sometimes we don't even know that it exists, and it has endless opportunities. So now Kurt is working for a speech therapy agency the name is Advanced Travel Therapy, and he's gonna talk more in detail about what he does at this agency. And without further delay, I would like to formally welcome him and thank him for being here.
Thank you so much, Maria Jose, and thank you everybody for being here. And I hope that this information can be really helpful for all of you. So yes, I studied Spanish and linguistics at Montclair State. Seems like a lifetime ago, but it really wasn't all that long ago. I graduated in 2013, and I've been working as a speech therapist since 2016. So my kind of background, I started out as a linguistics major at Montclair, and I just happened to take a couple Spanish courses because I was always interested in Spanish and wanted to continue learning Spanish, although I was majoring in linguistics. And eventually I stumbled on the first translation course. Speaking with Profesora Vizcaíno, I was quickly convinced that I should add another major. I think in my junior year, I had so many credits in Spanish already that at that point, it was time to just add the next major. And then I also completed the certificate minor in Spanish translation. And at that point, you know, I was a Spanish and linguistics major. I already had decided that I was going to go on and get my master's in speech pathology, hoping that I would be able to continue at Montclair State, which is ultimately what I did do. So what I didn't realize was how much I would be using both of my majors in my job and even in grad school. Many of the courses, especially the linguistics courses, the Spanish linguistics courses, particularly the syntax, morphology, and phonetics courses, phonetics and phonology, were incredibly helpful in, it says I'm muted. Can you hear me?
Yeah. Okay.
They were incredibly helpful in my master's classes, so the classes for speech pathology. That goes for both the linguistics classes in English and the linguistics classes in Spanish, because of course the theory and the technical things that you learn in those classes can be applied to both languages. So again, just the undergraduate classes that I took prepared me for the graduate classes. And then of course, those graduate classes prepare you for the career that is speech pathology. So now, a couple of years later, I work as a traveling speech therapist. And if you've never heard of that, many people have heard of travel nursing. So essentially what my agency does is they find contracts all around the country where there are schools, nursing homes, hospitals, private practices that are desperately looking for speech pathologists, occupational therapists as well, physical therapists, and even nurses for either short-term or long-term positions. So sometimes it's a maternity leave, sometimes it's a sudden sick leave, sometimes there's just nobody out there, and you know, some remote parts of the country where it's just very hard to fill these positions with you know, professional people with professional degrees like a master's in speech or a doctorate of physical therapy. So I started working for this company right when I graduated, and I moved right out to Washington State. And I actually started working in a school, which is not where I thought I would end up after all of my clinicals, which were really more medical based. And after working for that school, I moved back home and I started working at Morristown Memorial, or Morristown Medical Center, which some of you might be familiar with, as a speech pathologist, kind of across the board, in all different departments. So I worked in pediatrics, primarily doing feeding therapy, and also doing any bilingual or any Spanish-speaking evaluations, whether that be adults or pediatrics, in the outpatient center. So it was really, really helpful for me to get this job because of my Spanish-speaking skills. And I think it really set me apart from other candidates because Morristown is incredibly, incredibly competitive. I will say that I still keep in touch with everybody there, and there is still a need for speech pathologists, occupational therapists, physical therapists that speak Spanish. So any of those things would be a good, nurses even. So keep studying Spanish if you're interested, and it'll definitely lead to good job opportunities. So anyway, at Morristown, I also worked in the acute care side. So I worked with a lot of stroke patients, helping them recover their language and swallowing skills. Swallowing is something that I didn't think was part of speech pathology until I got to grad school, and I realized that it's actually my greatest passion. It's really so interesting to me. And again, studying linguistics, funny enough, helped me understand the mouth and how swallowing worked. So it just kind of all really tied so nicely together. With regard to translation, so how would translation courses help me in speech pathology? Translation really makes you think about language in a different way, and it just challenges your brain in so many ways to just think. You really have to think in both languages. It taught me vocabulary, it taught me grammar skills, it taught me conversational skills, it taught me writing skills. And I can't tell you how many times now that at work, I translate documents for patients. I translate educational forms for families. I translate sometimes my notes for families. Sometimes I do it verbally, and sometimes I do it in writing. I've been on a project. I did a project for Atlantic Health for Morristown Medical Center to translate their whatever you call it, like a booklet or an advertisement for their outpatient therapy services. So it's just really, really come in handy. And it also helps me recognize really poor translations out in the world, which is always just fun. So now, of course, many of us are at home, and I do have a travel therapy contract right now in California, but I'm located in New Jersey just because the pandemic has kind of limited my ability to travel, and the schools that I'm servicing right now are actually closed. So everything's online, and I'm working from home at the moment. But as of a few months ago, I was working from Spain. So just another thing to keep in mind. You can be a travel therapist. You can also be a teletherapist. So right now I'm a travel teletherapist, and I plan on going back to Spain next month if everything goes well. I should be getting back to Spain. So, think about that too. You can be anywhere in the world, and as long as you're okay with the time difference, you can work as a speech therapist, an occupational therapist, a physical therapist from anywhere in the world. I guess I should talk a little bit more about just the Spanish program and how it prepared me, the Spanish and linguistics programs, how they prepared me for speech pathology. So if you think about, speech pathology, most people think, oh, a speech therapist, they help kids work on their R sound, or they help kids work on, stuttering. But speech pathology is so, so much more than that. We work with, in the pediatric world, like I said, we work with children with feeding disorders, with oral motor issues, texture issues, food sensitivities, food aversions, picky eaters. We work with children, obviously, that have speech development issues. So speech sounds, the actual sounds that they're making are incorrect, and we, of course, can correct those sounds. And again, having a really strong basis for phonetics and phonology is going to be really helpful for that. We also help children that are delayed in their language development. So maybe they're, they're a little too old and they still haven't developed, still haven't started to speak. So again, a lot of that is parent counseling and direct play-based therapy with those children. I have to say that particular age group is an age group that I work with, that I use most of my Spanish with that age group, because most of those children are not exposed to English by the time they get to me at, say, age 2 or age 3. They're only hearing Spanish at home. So not only does it allow me to evaluate them in Spanish, but it also allows me to work with them and treat them and train their families in what I'm doing so that they can carry that over and use it when I'm not there, or when I'm not on the screen, or when I'm not with them at school. Then there are children, the school-age children, that again have speech issues and have language issues. Again, classes like syntax, classes like morphology are incredibly helpful, because again, you're learning what the basis, what the structure of our language is, and that is exactly what these students struggle with. They don't understand the structure. They're not lucky like us, where they just kind of absorb the structure naturally in their home environment. It just didn't click for them. So you have to explicitly teach them the structure. And if you don't have a basis in morphology, phonetics, syntax, grammar, you're not going to necessarily be able to teach it. And of course, you do learn all these things in grad school, but having a strong basis in undergrad was invaluable, absolutely invaluable. And then just, again, working with families, with patients, in the hospitals and schools that speak Spanish or that speak other languages, having that background in Spanish has given me the ability to understand cultures and approach different cultures in a completely different way than my colleagues. And it's so interesting, because sometimes my colleagues will come out of, let's say, a patient's room, and they'll say, "Oh, that family, I just can't get through to them. They don't want me in there. They don't want help from me." And, I go in, and let's not even say it's a Spanish speaking family. Let's say they speak, Mandarin. I go in just with a completely different, I think, perspective and a respect and openness to their culture that I think many of my colleagues just don't have it in them. And it's not something that we explicitly learned in the Spanish program, but it's just something that I have noticed at every single job. And I've worked across the country, I've worked across settings. Every single place that I work, I tend to really get along with those families that don't have English as a first language. And it means a lot to these people just to be heard. And then forget it. When they're Spanish speaking families, it's always great, because they always say, finally somebody who speaks Spanish, and we can really explain all the things that we're going through. And I can really communicate, for example, concerns that families have to the doctor that they weren't able to communicate through even an interpreter. So anyway, just endless benefits. And I do want to also mention that in every job interview I've had, as soon as I mention that I speak Spanish, I'm hired on the spot. And that's happened more than 10 times. Every single conversation I've had with, my future boss or a future manager, usually we end up speaking about the patient population or the student population. And almost everywhere I've worked, except for St. Louis, there's a significant Hispanic population, a significant Latino population, a significant Portuguese population. And so as soon as they mention that to me, I say, well, I speak Spanish. And of course, the first question sometimes is, well, do you really speak Spanish? And I respond, yes, I really speak Spanish. I majored in it. I'm fluent. I did a translation minor. Translation, it's just one thing after the next. And it's just, I can't emphasize enough how important it is, especially in the medical field and in the school, whether you're going to be a teacher whether you're going to be a therapist, a nurse, a doctor, a social worker. I haven't mentioned that, but that's incredibly important. Social work, again, in schools and in hospitals. It's also a really incredible job. Another thing to maybe consider if you're thinking about careers. Having that second language or a third language is absolutely invaluable. So if anybody has any questions, I feel like I've been talking for too long. So shoot some questions at me.
I had a quick one.
Sure, Felicia.
Sure. Okay, so I plan on being a nursing major here, or criminal justice major. So what would you recommend minoring in? Because I know you can't really major in can't really have a double major in nursing. So what would you recommend minoring in?
So you're currently a nursing major?
I'm a public health major going on to the nursing path, but I'm trying to get
Sure.
into a 5-year master's for psychology. So I'll be a double major anyway.
Okay, that's great. I would definitely say, you can minor in Spanish just to make sure that you have those fundamental classes, but don't be afraid to take a class that's not necessarily in the list that you need for the minor requirement. And if you're working in any kind of public health or public service setting, I would highly, highly recommend taking at least as many translation classes as you can, because those classes are especially going to be fundamental for your job, for getting those, again, like I said, conversational skills and your technical writing skills. I mean, heck, the translation classes helped me with my English writing. So I just can't emphasize how important those classes in particular would be, even if they're not part of the Spanish minor.
Okay, thank you.
Sure.
I had a question.
Sure.
So have you ever worked with a patient that like they had, let's say, like a stroke or like some like attack or like medical, emergency, un ataque, por ejemplo, like and then they have to like regain their speech? Because I'm currently going through that with like in my family. So I wanted to know like anything, like how did it go? How long did it take them to get back to talking?
Absolutely. So exactly what you're describing is the primary thing that I do in the hospital. I work with patients that, again, have had strokes, brain injuries through car accidents or falls, and I work with patients that have trouble swallowing, which is also common after a stroke. Every single case is different. It depends on how quickly the patient got treatment after the stroke, how quickly they got to the hospital and how quickly they were administered possibly a life-saving drug to prevent the brain from getting further damage. A lot of times what we say, at least neuroscience tells us, that in the first few months of recovery, that's when you're going to see the most recovery. They used to say that in the first 6 months, that's really the maximum recovery period. But now they're saying that really there can be maximal recovery in a year. That doesn't mean that after a year, there isn't any more recovery. Patients can still make progress. But that first 6 months to a year is really crucial, that those patients are getting tons of therapy and that the family or some kind of caregiver can follow through with carryover exercises at home. And that's true for stroke patients, that's true for children, that's true for everybody. But it's really, really crucial for stroke patients. That said, I've definitely worked with stroke patients in English and in Spanish that have completely lost all of their language, that have lost their comprehension ability and their expression ability. And I've worked gradually building on those skills, getting those skills back. One patient in particular that I'm thinking of, I worked with him last summer. When he first had his stroke, he lost all ability to speak and all ability to understand. He was speaking, but it was gibberish. It didn't make any sense, for kind of lack of a better word. And I was lucky enough to see him right when he got in the hospital. And then I followed him into the acute rehab, which is kind of a step down where they're getting intensive therapy, 3-4 times a day. And I worked with him every single day there. And that's when we really saw the most progress, where he was starting to recognize letters and starting to read I would take him on walks and he would read the numbers on room numbers. And I took him to the garden and he would label some of the plants outside. And by the time he was discharged, he was speaking fluently, still had some funky things coming in and out of there, and sometimes wouldn't quite understand me. And then I followed him to outpatient, and I saw him twice a week in outpatient. So kind of that, it was nice to see him from start to finish, because by the time I finished that job, he was actually discharged from all services. He had met all of his goals, and he made like a full recovery. I think he was very lucky. He was lucky in that he was young and he was a very active guy, and I think that really helped his recovery. But yeah, I don't know if you said a family member is currently getting therapy.
Yeah, so he's currently getting therapy. Thankfully, like, they FaceTime me from like the center that they're in, and he recognizes me. He says, "Oh, hi, niece." Like and he mumbles. Oh, sorry.
No problem.
Like, they're currently like, I think that was my uncle calling me right now, probably. Yeah.
Yeah, so it's good for family members, and especially I keep saying this to all of the parents that I'm working with now at the school. This is a great opportunity for you to learn what a speech therapist does, so you can do this with your child or with your patient or with your son or your daughter or your cousin or your uncle, so that you can carry over these activities and continue to work on these strategies, not just the 30 minutes or 1 hour of speech therapy that they're getting per week.
I have another question.
Go for it.
You mentioned how the guy who had a stroke has all memory of how to speak, talk, and everything, right? I don't know if you have heard of the case Jeannie. It was a girl who never learned to speak and talk. So since she, with speech therapy and help and everything, she was never able to speak. She was able to point out words, and then her, I guess, ability to speak went down.
Yes.
So how, I don't mean this like in roasting you in any way, shape, or form, but like how does he regain how to talk? And
it's a great question. And actually, so the answer would be, is kind of explained by neuroscience. Jeannie was kind of an experiment, not a good experiment, but she's used in neuroscience to explain that critical, I don't know if you've heard of the critical window of language acquisition.
I've heard of that, yeah.
And so because she was never exposed to language during that window, her brain, the synapses in her brain were put to work doing other things. Maybe they were put to work to help her survive, or to help her with just kind of some of those basic survival needs. Because she was never exposed to language, it was very, very difficult for her to acquire it. When children are born, they have all these synapses that are ready to start making connections. So, when you're born, you learn a language just like that. Versus when you try to learn a language after, the age of 12, 13, 14, it's a lot more difficult because your synapses have already made connections and kind of become efficient. For somebody who's had a stroke, the language area in the brain, there are many areas in the brain, and maybe only one of those areas was affected. So maybe what we have to do, and what I like to explain to a lot of my patients that can understand this, is we need to work around the accident that happened in the brain. We need to work around like the dead zone. So we need to actually build new synapses and new connections around the area of the brain that's no longer working. After a stroke, there's a huge chemical imbalance that's set off in the brain because the brain is trying to heal. So sometimes as that imbalance becomes more balanced, we see some spontaneous recovery. At that same time, we really want to target the brain while it's spontaneously recovering and show the brain how to heal, show the brain how to reorganize. So again, Jeannie, I believe it was Jeannie, she never was exposed, so she never formed those synapses, versus a patient that did have language. The synapses are there. Some of them might be injured. We just need to work around the affected areas.
Okay, thank you. Sorry.
You're welcome.
Since he couldn't produce speech and he also couldn't understand, does that mean that Broca's area and Wernicke's area were affected? So a lot of his brain was affected, right?
Yeah, it's actually interesting. His brain scans showed only Wernicke's area. And so what he was producing was kind of a classic Wernicke's aphasia, which is a language disorder. So although he was producing speech, most of the time it didn't make any sense. So there were a lot of real words in what he was saying. And if you didn't know English, you might even think he's speaking English because the sounds he was using, the phonology, was correct. The phonology was English. Even sometimes the word order was correct, but the semantics, the actual content was just out there. Now, of course, the first day I met him, the only thing he could say was 5,000, 500 miles. He kept saying some number, 5,000, 15, 50. And then he kept saying, 5 miles an hour, 15 miles an hour, 5,000 miles. I don't know if it was because he worked a lot, he walked a lot, and he walked many miles a day. Maybe it had something to do with that. Another day, his word was worm, and he was stuck on the word worm. So as we were looking at picture cards and I was showing him, I would say, look at this picture. This is a dog. And I would have him look at my mouth. This is a dog. Try to say dog. And he was stuck on worm, 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 worm. A different day, he was stuck on a word that his brain made up. So it sounded like an English word phonetically, but it wasn't a true word. So it was what we call a neologism, which is just a word that his brain created following the English phonology rules. And he was stuck on it. And he was starting to realize that day, I remember, that he was stuck on that word and he kept shaking his head, but that's the only thing that would come out. But good question. Usually Broca's area, the comprehension is pretty intact, but the expression is difficult. If Wernicke's area is affected, the comprehension and his ability and patient's ability to understand what they say, not only what you say to them, but what they say, is affected so that they can't even self-monitor. So he couldn't, for the longest time, he didn't realize what he was saying didn't make any sense, and he was frustrated because he was giving you faces like, I just told you, but what he had said didn't make any sense. Until later on, some of that self-monitoring ability started to come back.
Thank you.
Sure.
I have another question.
Go for it.
Do you know what areas like in the back?
The occipital lobe. So it's usually, it usually has to do with vision.
Okay.
But it also has to do with some comprehension and processing of like spatial relationships.
Okay, I see. Okay. Cause yeah, that's what happened to my uncle. Like something happened. It was something with his blood pressure or something. And I'm just trying to like research about it so I can help him when I see him.
Absolutely. Did he have a hemorrhage?
I think it was like blood something with blood.
Mm-hmm. So he may have had either a hemorrhage or some kind of aneurysm in that part of the brain because of that higher blood pressure versus other types of stroke, which are similar to a heart attack, where you have a blood clot that ends up shooting up into your brain, blocking a blood vessel, and then you have a dead zone in the brain, just like you would have with a heart attack.
Okay.
It's a very, very it's basically the same thing. A heart attack's in the, in the heart, and a stroke is in the brain.
I have a question. Sorry. So I had a family member. She passed away now from a stroke, actually. So when it like clocks, like what does it do? Because we knew she had 6 strokes within like a span of like a month. So like how would it like so how would it like affect the brain? Because when she had her first one, she had 2, and then she couldn't really walk or talk.
Mm-hmm.
Then I think a few weeks later she had another one, and then whatever progress she was making, she lost it. Sorry, it's
no,
so
it's and I'm sorry about your loss. It's actually very common what you're describing, where sometimes one stroke might go undetected, or sometimes maybe a patient will feel a little bit off one day and they don't realize that they've had a stroke. Maybe they have a little balance issue, or their memory's a little off that day, or they had trouble speaking in the morning, but then it was better in the afternoon. So with strokes, the blood clot type of stroke, it depends on the size of the clot and where it lands. So if the clot's very large, it's going to occlude or block a larger region of the brain because it's going to block a vessel that might divide off and feed a larger section of the brain. If it's a small clot, a really tiny clot, it really may go into the brain and block a tiny, tiny little part of the brain that causes just minimal death to the cells that little tiny artery was providing blood to. So sometimes when we see those multi-strokes, those multiple little strokes, that's because there's a larger clot somewhere else in the body, and little pieces of the clot are breaking off and going up into the brain. And so sometimes we notice after the 5th stroke the symptoms. Or sometimes we don't notice at all, and then the really big clot does make it up, and we realize, oh, they've had this really massive stroke, but a year ago they had 6 little strokes all over the brain. So that typically is what happens, where there's a clot somewhere in the body. A lot of times the heart is at fault, or there's another artery somewhere in the body that has a clot, and just little pieces break off little by little.
Thank you.
Sure.
I have a quick question. Okay, hi. So I heard that you're
Oviedo.
Yes. Hi, Kurt. So I wanted to ask you something very quick. I heard that you're talking mostly about speech pathologists in medical centers and like more on the medical side of it. So you also mentioned something about bilingual and Spanish speaking evaluations. Do you know if they're actually hiring Spanish speaking pathologists in school districts, or this is like a service, like a separate service that they will hire from a center or something else?
Yes, absolutely. It is, I can't even tell you how helpful it would be for you to, if you wanted to become a speech pathologist, to be a Spanish-speaking speech pathologist. So I don't call myself like a bilingual speech pathologist. I just always tell my hiring, manager that I am bilingual and I speak Spanish and I write in Spanish. Every single school district that I've worked in Washington State, in Colorado, and in California, and another one in Washington. Of course, in New Jersey, we know the Latino population in New Jersey is huge. They all are in such high demand for truly Spanish-speaking speech pathologists, so that when you have these students that their primary language is Spanish, we need somebody who can evaluate their primary language, not their English, because maybe they just got to the US 2 weeks ago. Last year, I had a 14-year-old who actually got to the US 3 years ago, but he came to the US when he was 11, and he never acquired English all that well. He had behavioral issues. Half the time he was out of class. So I evaluated him for the first time in Spanish. It turns out he actually had a language disorder in Spanish as well, where he also had problems with grammar, with vocabulary. He was very limited in Spanish. But what my report showed was that his scores in Spanish were higher than his English scores. So at least we could see that the language disorder was across the board, right? It was bad in English and it was bad in Spanish, but we could see that he had a relative strength in Spanish versus many other students that I've evaluated that are clearly native Spanish speakers. I evaluate them in Spanish. I say their Spanish skills are great. They don't need speech therapy, and they're discharged, or they're not put on a special education program.
Okay, but in this case, were you hired by the school district, or
Yes.
It was like a service you were providing for your medical center, and then they call you from there?
No, so in those cases, I was hired by the school district to be a school speech therapist.
Right.
I worked in the school. Sometimes right now, for example, I work in the whole district. So I have one school that I'm taking care of. I have about 40 students, but one day a week, I'm assigned to do assessments all over the district, any bilingual assessments. Okay. So these are not my students per se, they're other speech therapist students, but because I'm one of 3 bilingual therapists in this district, we are doing any assessments of students that we believe that their primary language is in Spanish, because it's not fair to assess them in English.
And do you need like a certification that shows
You
that
don't.
you're bilingual, or you actually don't?
You don't, and that's a really good question. It's a question that I always had. I know that there are bilingual certifications out there. I have never been required at any of my jobs to show. I think it's a money gimmick.
Yeah.
I think that as somebody who speaks Spanish fluently, if you confidently feel, and if you ethically feel that you can evaluate Spanish skills, then go for it. And especially if you have that background in Spanish linguistics, so those Spanish linguistics classes, phonetics, what else did I took phonetics, phonology, and
Grammar.
the linguistics course. They were incredibly helpful.
Thank you very much.
You're welcome.
Yo te quiero
Go
hacer una
for it.
pregunta en español para que vean los estudiantes no nativos del español el nivel que tienes, y hablando de la importancia del español. Me ha hecho mucha gracia porque Mayerly, de apellido, se llama Oviedo, y yo sé que Kurt tiene una conexión especial con Oviedo, que es una ciudad de España, ¿no?
Sí.
Sí, sí.
De Asturias. Push Asturias.
Asturias, patria querida. Yo quería hablar un poco, he hablado antes de la importancia de la cultura, ¿no? De cultural sensitivities. No solamente en el español, sino en cualquier otra cultura en donde haya un problema con el habla, ¿no? Y cómo el aprender un idioma te hace sensible, te hace abrir tu mente a comprender otras culturas, y eso ayuda en tu trabajo, ¿no? En el aspecto más humano, si quieres. Tengo curiosidad por saber cómo han manejado el reto que supone que el español se hable en 23 países distintos, que a veces la cultura caribeña es distinta de la cultura latinoamericana o de la cultura del español de España versus el español de Estados Unidos. Si han manejado situaciones culturales donde te ha ayudado tu conocimiento del español en esas variedades distintas del español.
Pues por supuesto, las clases de español, las clases de lingüística me ayudaron muchísimo, porque claro, si tú no tienes conocimiento de otras culturas, de otros dialectos, de otros léxicos del español, a lo mejor tienes un cliente, un estudiante con quien no puedes hablar bien. Entonces, estando en ese programa, haciéndome amigos de todos los países, estudiando la cultura, también otra clase que también recomendaría, la cultura de España y la cultura, creo que es una clase en inglés, Latin American Studies, con Boletino, no sé si todavía está.
Yeah, it's a LALS 201 and 205, and a lot of students from 205 are here. Lo digo
Excellent class.
en español. Es una clase que nos da muchas satisfacciones.
Sí, a mí me encantó. Y the best class. Is Boletino still teaching?
He retired.
He retired. Oh,
Yes.
He was spectacular. Pero esas clases y estar en Comrade Schmidt y relacionarte con eso, con gente de todos los países de Latinoamérica y también de España, te da el cultural competence que vas a necesitar en tu trabajo. Y no es una cosa que puedes necesariamente aprender en una clase. También tienes que relacionarte, hacer amigos, quedar con tus amigos después de las clases, ir a eventos especiales. Por ejemplo, recuerdo que fui a un evento, una charla que dio Lidia Falcón. Conocí a Lidia Falcón, a Carlos París, a Javier Cercas, es un escritor español. No sé quién más vino durante esos años. Mucha gente vino y hay que ir a todos los eventos que puedas para ir cogiendo esa competencia cultural que tanto necesitamos en este mundo, especialmente si vamos a tratar con gente si te vamos a trabajar en hospitales, en escuelas, da igual, da igual. Si trabajas en el mundo de los negocios también. Porque si entiendes, si eres capaz de entender otra cultura, aun si no entiendes, aun si no eres familiar, si no conoces bien esa cultura, da igual, porque tú ya tienes un conocimiento de muchas culturas, entonces ya estás abierto a las posibilidades de que las cosas no se hacen igual, ¿no? Las cosas no se hacen como tú o tu familia las haga. Es súper importante. Y eso, como dije antes, que muchas veces mis compañeros tienen relaciones un poco difíciles con sus clientes o con las familias o con los padres de los estudiantes o de los pacientes. Y sin embargo, yo no tengo esa dificultad. Y no es porque yo sea especial. No tengo nada de especial. Pero soy una persona mucho más abierta y reconozco las posibilidades y las diferentes perspectivas del mundo. Hay culturas que no ven bien la terapia, que lo ven como un problema, lo ven como una cosa negativa. Y es verdad que en Estados Unidos lo vemos como muy, muy normal, porque lleva el campo de las terapias lleva mucho tiempo, hay mucha educación. Cada 2 por 3 tu nieto, tu hermano, tu sobrino tiene terapia, tuvo terapia, estuvo en terapia cuando tenía 2 años. Es muy normal aquí. Y en otras culturas no lo es, no lo es. Y hay culturas también que rechazan la posibilidad de que el niño o de que su pariente tiene un problema. No quieren saberlo porque eso sería una cosa muy negativa, una maldición, tipo eso. Entonces, hay que reconocer que el mundo no es Estados Unidos.
I think it's very interesting what you just said. And I don't know if everybody speaks Spanish here, but I ask a question. So I'm going to make a very, very brief summary. Kurt was pointing out the need and the importance of the role of culture, because in some cultures, therapy is considered as something negative. So if you're aware of those cultural differences, you're going to be able to treat that person better, right? Or to serve that family, that parent in a different way, in a different perspective, because you know the culture. So exactly. We have to think outside the US and not think about only the American culture, but that we are living in a multicultural world and we are serving multicultural populations, sort of, right?
Absolutely.
And another thing he said was that he loved LALS 201 and 205, the classes that he took with Professor Valentino, now emeritus, retired, and that those classes serve him well in making him realize about the importance of cultures. And also, Kurt mentioned the fact that these cultural activities that we're enjoying now, I'm adding that enjoying now because he didn't say that, but to be faithful. But these cultural activities that he participated in were crucial to make him culturally aware. And that is very useful now. And so, you know, you're participating in these cultural activities and the LALS class, which opens this view of the world that in some cases is very useful for your future career. A question I have for Kurt is, when you came to Montclair State University to do your double major first before you went on into this fantastic career that you have now, your level of Spanish was good?
That's a good question. It was not what it is right now. It was good. It was good. I was not quite as conversational. I had a really good grammatical background from high school. I took the AP IB Spanish classes, so I had, you know, good reading and writing skills from those classes. What we didn't do so much of was conversation, and I remember that pronunciation was never important. So I came in, I knew that I didn't want to speak with an American accent, but that's what I used in high school, because if I used anything else, it would be like shameful, which is ridiculous, but that's high school.
Peer pressure, yeah.
So actually my first year in college, I spent at the University of Delaware, and I was a Spanish major, or a triple language major. So I took Spanish and French at the time. So I took a couple courses. I thought they were too easy. Got to Montclair, and I think my first class was maybe the grammar class with Professor Soto.
Mm-hmm.
Blew my mind. That was very, very difficult, but excellent. And again, I was looking at my notes the other day, because it's hard, but it's a great class. It really gives you so many fundamentals. And then again, as I started making friends in the Spanish program, not only with the students, but also with the faculty, it really just, I would walk into Conrad Schmidt, or before Conrad Schmidt, we had, what was that awful building?
Dixon Hall?
Yeah. Have they demoed that building yet, or is it still up on?
Still there and the same.
Yeah. Anyway, but I would walk into, especially Conrad Schmidt, which really is a language building, it was just like immediately walking into like a Spanish conversation club. And so when I did, when I graduated with my bachelor's degree, I went to Spain for 2 months. And I just wanted to go to Spain. I wanted to get to know the country. I've always been fascinated with Spain. So I took off for Spain, and I was alone, and I spoke Spanish for 2 months, and I made lots of great friends. And I actually saw Maria Jose in Almeria and met her family. I went to a bullfight. I went to a soccer game. But I really got to use my Spanish there. And at the beginning of my trip, I think my accent was probably more Colombian from a lot of my friends at Montclair. And of course, after 2 months, I kind of picked up the acento ibérico. Well, entre muchos, the most like standard, I guess.
Yeah.
But then I came back home. I went to grad school. That was another about 3 years. And then I took off for Spain again for another month and a half. And that's when I actually met my husband in Spain, in Asturias, very close to Oviedo. And of course, speaking with him every day I'm always learning. I'm always learning new expressions and new vocabulary. But really those friendships, those opportunities to speak Spanish outside of class, if you're not a native speaker, though, really pushing yourself a little bit just to be a little bit uncomfortable. Nobody's going to judge you if you're trying to practice or improve your Spanish, especially within the Spanish program. Everybody's going to be all for that. So yeah, I would definitely say that it's not just participating in class, but also having those friendships.
Yeah. It's so rewarding for us to see how a student's life takes flight and becomes something so important for so many people, because you touch so many people, and you can do your job twice as well, precisely because you are culturally aware and bilingual.
Absolutely.
And
yeah.
That is really an asset. That is, it goes in both directions. It's not only for you a satisfaction and also a job opportunity, but it's also for those people that you touch with your expertise.
Definitely. And it is rewarding. It is such a rewarding field. Again, when I was studying, I didn't think that I would want to work with children. And now I probably spend half of the year working with children and half of the year working with adults. But no matter what population I work with, I think it's incredibly rewarding. And again, just having the competence to work with our Latino populations is beyond rewarding. And I mean, I've had moments where I'm crying, the patient's crying, everybody's crying because finally someone is speaking Spanish to them. And I can't tell you how rewarding just that moment is when I walk in the door and I see that everybody in the room is speaking Spanish, and I walk in speaking Spanish, and just the looks you get and the appreciation you receive for that is really incredible. And I imagine that that would be the case, again, outside of the medical field, outside of schools, but also in business and in finance and really anywhere, because this world is so multicultural, and you never know, what the primary language of the person that you're speaking to might be, no matter, what field you're working in.
Excellent.
I don't know if I mentioned exactly what I've done with travel therapy. I don't know if anybody else likes to travel, but with travel therapy, what you're able to do is actually oftentimes take short-term contracts, which you can often extend, but minimum typically 3-month contracts all around the country. I really like the West Coast, so I've been on the West Coast a lot, but also, like I said, I've been in St. Louis, and I've also been in Denver, Colorado. But I've been Washington, Oregon, California. I love the mountains, I love the beach, so I love those those areas of the country. And a few times I've just taken my 3-month contract and I've left. Other times I've gone back. Other times I've extended my 3 months to become 5 months or 6 months. And, that has also increased my cultural competence just of the United States, because I remember my first travel contract I took out in Washington State. I lived in a really impoverished community where many of my parents were struggling with drugs, with alcohol. Many of my children, my students were foster children. I came from a fairly wealthy part of New Jersey. I had never experienced anything like that. And so I remember, giving a sticker to my students at the end of their class, at the end of their speech class, and the smiles and the laughter and the appreciation for just a little sticker. And I remember thinking, if I gave a sticker to a kid in New Jersey, they'd probably say, "That's it? Where's my toy?" And just so, the experience of working there was incredible. Then working in St. Louis, I had never worked with a majority of African-American patients. So, nearly all of my patients were African-American. There were almost no Spanish-speaking patients there, like I said. But another culture that I had never been exposed to, and I loved it. It was so much fun. So just seeing different walks of life, again, different perspectives, different priorities. Let me tell you, the West Coast, the priority is not work and make money. The priority is making weekend plans, or taking a hike after work, or taking a walk on the beach.
Very relaxed, right? Yeah.
Yeah, and yeah, they do work, and I think they work just as hard as we do. But I think on the East Coast, I don't know. Is it the traffic? I don't know what it is. We're so stressed.
The weather.
The weather, that doesn't help either. So just seeing different walks of life, different paces, different priorities that people have, what really matters to them. It really just changes your brain and changes the way you think about your own life and your own priorities. So travel therapy not only, kind of expands your opportunity or expands your perspectives professionally, but also personally. It's awesome.
Wonderful. Any other questions? I was seeing the chat is on fire. A lot of people making very good comments. Then we will send them to you, so you can read them.
Perfect.
Carmen had a question. Yeah, go ahead.
¿Cuáles son tus grandes satisfacciones como ser humano dentro de esta profesión? O carrera o trabajo.
¿Me lo puedes repetir?
¿Cuáles son tus grandes satisfacciones como ser humano?
Pues sobre todo las conexiones con mis pacientes que he hecho y la ayuda que les he dado. La ayuda, o sea, hacer un impacto positivo en la vida de otra persona. Y normalmente no es solamente el paciente o el estudiante, sino también los padres, los familiares, primos, esos impactos, esos impactos positivos, dar a una persona la habilidad de comunicarse, que es una cosa fundamental en la experiencia humana, ¿no? ¿Cómo vamos a vivir si no podemos comunicarnos? eso me gusta mucho. O también ayudar a un paciente volver a comer, volver a tragar cuando han estado no sé cuánto tiempo en un tubo o sin comer. Esos momentos son los más impactantes.
Muchas gracias.
De nada, no sé si
Tienes-
me he explicado bien.
Sí, gracias.
De nada.
Yeah,
I have a quick question.
Okay,
Sure.
yes, go ahead.
Okay. So, because you've been saying that you're like a travel SLP, and I wanted to know if, like, you know how you get the license, do you have to apply to every single state that you go to, or if you take the test or something to qualify? And like, if you travel, like you said, to Spain, do you have to like also do something with the license for that case?
Sure, good question. Travel therapy, I would say the biggest drawback, I think my only drawback, is the applying for a new license each time you go to a new state. So, you know, when you graduate, if you graduate from a program in New Jersey, you'll have all the requirements laid out for New Jersey, right? You'll have to get your license in New Jersey. You graduate, you'll have a clinical fellowship year where you're working with a supervisor. It's actually only 9 months. And then you're kind of free from there to work in different states and get different licenses. The licensing can be a little bit of a pain. Once you do a few of them, you get used to the process and you know what they're going to require, so you have all that stuff ready. There have been occasions, I mean, even last year, where I think I had to go to Montclair to get a form that the speech pathology department could sign off for me, just verifying that I had completed the program. But generally, all you're going to need to do is you take that one test when you graduate, the praxis. You'll never have to take that again. And most of the states have very similar requirements. So once you've completed your clinical fellowship year, those 9 months of supervised work, you pretty much have everything you need to get a state license anywhere else. Most travel companies, at least from what I've heard, will reimburse you for your licensing expenses. So yes, it can be a couple $100 to get a license in a new state, but as soon as you pay for that, your agency will reimburse you typically. You also get reimbursements for moving. So usually at the start of a contract, my first paycheck after I've worked 1 week, I usually get a bonus for the travel and moving expenses. And it kind of varies depending on how far I've had to travel. How far I've had to travel from either my last assignment or from my home. So there are lots of perks there. And then again, as a traveling therapist, and I think the same goes for travel nurses, this is a really big perk. Most of your income is actually tax-free stipends. So what you're actually being taxed on is a very low hourly rate, and the rest of your income is stipend based. So you have a housing stipend, a meals and incidental stipend, maybe some other stipend that's in there. Those stipends just go onto your regular paycheck. It's a regular W-2, but it's tax-free income. So you're not paying taxes on such a big chunk of your money like you would at a full-time, regular job. So that's kind of nice.
Jeanette Rosario had raised her hand, probably has a question. Jeanette?
Yeah, I'm here. Can you hear me? I'm driving.
Oh,
yes.
Safe.
Yeah, I got you on my dashboard. How are you?
Good.
So, I had asked a question.
This is a first, Jeanette. This is a first.
This is the first Zoom? Okay. Well, I graduated from Montclair. It's a wonderful school, and I graduated with a bachelor's in linguistics with the intention that I was going to pursue the speech language, but my setback has always been, I have a full-time job. My setback has always been the GRE. I can't seem to find a way around that. And I'm an older student, so it's my math skills aren't what they would be if I had gone through school now and gone to college at 18 or 19. I went later on in life, and I graduated later on in life. And so I'm a little worried about taking the GRE now and sitting for the math portion of it, because I don't think that I'm like at that level?
So the GRE is the biggest pain in the butt. I bought a book to study for it. I think one of the Kaplan books.
Okay.
And I remember, I think I only got through the math section because I knew that that would be my weakest area. I hate math.
Right.
I hate it. Luckily for Montclair, I think the math is the lowest requirement. Like you don't have to have a super, super high score.
Okay.
But you definitely want to take a look at one of those books. And I would go, if you're really worried about it, I would try to get through a whole practice book and get through those practice tests. Those practice tests are really going to help you not only figure out how the test works, but also it will, a lot of the questions repeat. So you'll see sometimes the identical or almost identical questions on the real test. So take as many practice tests as you can. It's time consuming, it's not fun, but it is 100% worth it. Take all the practice tests you can. Usually when you buy a book, they give you like 1 or 2 practice tests in the book, and then you have access to a few of them online. Do all of them.
Okay. Would it be worth it, would you say, to like sit with someone that can like run through the practice test with me, like a tutor? Would it be worth it to do something like that?
Potentially, it depends on how, if you maybe buy a book, run through a practice test, and if your score is really, really low, maybe potentially get a tutor for your weakest section. I don't know what tutoring expenses are like. I'm not sure if it's pretty high, but it might be worth it if you're really struggling like with one area and you're not able to get up to at least the minimum requirement for like the math section.
Okay.
But I do know that the GRE is not something that most schools, they do require you to have minimums, but it's not the most important deciding factor. If you speak Spanish, that's a big factor. They want people to speak Spanish. They also want people to have like any kind of exposure to speech therapy. So like if you can observe either in a hospital or in a school or in a private practice and just get some observation hours where you have a speech therapist sign off on a form that said, observed with me this student population or X number of hours, that can be another nice kind of benefit to, it can help you get in for sure.
Like I work in a school system. I work in an urban city in a school district doing something completely different. So I have the advantage and I'm exposed to it. I would sit with any speech pathologist and any speech therapist in any school. I definitely have that as my advantage. I have a lot of avenues, and you talking about it is not helping because it's just like really like I already really want to do this with my life. Like I'm almost in tears because this is all I ever wanted to do. And,
that's so awesome.
The only thing that's stopping me is that terrible GRE. I have a deaf sister, so I'm fluent in sign language. I'm fluent in Spanish and I'm fluent in English.
You have a lot going for you.
But the GRE has always...
Go for it. And
do it.
Go for it. Andrea Gutierrez has also a question, I guess. Andrea?
Okay. Well, thank you.
Hi, I just wanted to say first that your Spanish is amazing. But I also just wanted to know, how did you get into speech pathology? Like, what made you want to do that after college? Or did you already have that in mind before?
Good question. I kind of had it in mind when I was I think a freshman in college, or maybe even like the summer before freshman year of college, I started working for an interpretation agency. So I was doing interpreting for the early intervention system, which is the service in New Jersey that provides PT, OT, speech, and nursing services to babies, 0 to 3. So I had worked with physical therapists, speech therapists, and occupational therapists for like a year. And I was kind of course, on and off. It was like days when I didn't have class, and it was, here and there, but it did expose me. And I liked it. I liked speech, but the thought of going to grad school was like, oh no, I just want to like graduate and get a job. And I thought I was going to be an interpreter or maybe a translator. And after freshman year of college, actually during freshman year of college, I realized I can't pay for the University of Delaware for 4 years. I've got to move home to New Jersey. I'm going to go to Montclair. And I was researching programs, and I saw that they had the linguistics program, which might line up nicely with speech therapy. And so I kind of talked myself into accepting that I would be going to school forever to get my master's. And that's kind of how I got in. That's what got me interested. So I was exposed a little bit and kind of saw how therapy worked as an interpreter, and ultimately ended up being on the other side of that.
Oh, that's really cool. Thank you so much.
Yeah, you're welcome.
There is a question in the chat. Juan Cherenfat wants to know what was the most hard part of the process of learning Spanish? What was the hardest thing?
For me personally, getting over the fear of making a mistake when I speak. I think that's for everybody when they're learning a language. You can study the grammar, you can study the vocabulary, you can do all that stuff in your head and on your phone and in reading books, but putting yourself out there, especially somebody like me, where I'm not really a shy person now, but I definitely used to be very withdrawn and shy and timid. And so especially speaking Spanish in front of a class of oftentimes many native speakers was always nerve-wracking for me, but I had to do it. I had to do it for the grade, and I had to do it for myself. I knew that if I didn't do it, I would never master it. So again, in class, speaking Spanish, and then outside of class too, just saying, hey, can we speak in Spanish? Or just starting a conversation with one of my friends in Spanish. I think that's the hardest part, because for me, the grammar came fairly easily. I kind of like that Spanish has rules, and you can memorize those rules and pretty much guarantee that they're going to apply in most cases if you know your exceptions. And in English, that's not the case. So I feel bad for anybody that has to learn English. But Spanish has a lot of really nice rules, and reading Spanish, you read exactly what you read, or you say exactly what you read, and
That's an advantage. Yeah.
thank you, Joe. Juan, that's what I would say. The hardest part was probably just forcing myself to practice speaking.
Just to follow up to what you just said about Spanish and the pronunciation, the regularity of sounds and rules, and I also taught English in a previous life, and the difference that I can see between students learning English and students learning Spanish is that a student that learns English, when somebody speaks English, and if they pronounce the word properly, they know the word. Whereas English speakers can read fluently in Spanish, deceive you as if they are totally fluent, and they have no clue what they're saying.
Absolutely. Yeah, that honestly, the sounds in Spanish are the easiest part once you kind of master what they are. I remember, I'm going to sound like a total nerd, but I had trouble saying certain words, and I would remember, in class, I read a certain word out loud and it just didn't come out. And I don't know, I can't even think of an example. And so I remember that night I would go home, and in my room, I'd be silently repeating it in my head or out loud to myself, to try to just get that, that tongue pattern down pat. I really wanted to master, and my Spanish is not perfect. It probably never will be, but I think all of my interest in trying to make it as good as it could be, and then the continuous practice, using it at work, now using it, with my husband, it's only going to get better, right? But it's a matter of practice.
Absolutely. Well, I guess if there's no other questions,
there's one other question that maybe could be the last one, but I am going to read it from the chat.
Wonderful.
From Yahadel Perez. She says, I'm a student currently in the Speech Language Pathology Master's Program at MSU. I am bilingual in Spanish, as it was my first language. I speak fluently, but not professionally. I'm wondering if there is any coursework that you recommend to learn speech language pathology terminology, or do we just learn through experience?
Ooh, yes, I can definitely recommend. Take the translation classes. Take them, all of them.
What was it, translation classes?
Yeah, so in the translation classes, you especially, I don't know which one it is, but we did all technical writing.
there's one class in translation and health services that maybe, I don't know.
That would be the one. Otherwise, you know, of course, you're not going to learn everything in that class, but you're going to, when you get on the job, you're going to see what words are most important to you in the first week. And of course, you know, with children, you're going to use just normal language, right? You're not going to use anything fancy. In the hospital, you might want to use some technical language, but don't get too technical, because remember that the people that you're speaking to don't understand technical language oftentimes. So I've even caught myself sometimes saying like the word deglución, which who the heck knows? I mean, nobody uses that word. So I, you know, have transitioned to tragar, because you sound ridiculous if you say deglución. So again, I would definitely, if you're thinking you're going to work in the medical field, I would definitely take that like a health or technical translation class where you're learning kind of technical or even legal language. I remember Professor Militich taught like I think that was the technical class that I took. We did like a section on medical, scientific, legal, et cetera, That was a really great class for learning kind of all that that language.
I just put in the chat that my email is there. If you want to know more about the translation program, you can.
I put my email in too.
Right.
Yeah.
If anybody has like questions, or they want to email me, or I didn't answer your question, or you're in the Montclair's speech program and you want, you know, help, or you're looking to get in, or anything.
Thank you so much.
Yeah, you're welcome.
And for students who are not fluent in Spanish, but they want to start learning Spanish, we also offer now, that is after your time, Kurt, so actually you didn't know this, we offer Spanish at the 101, 102, and 103 level, but for health practitioners. So those studying nursing or anything related to health, we have those courses also that are geared towards students in the health profession.
That's fantastic. Yeah, I didn't take those courses, but I would recommend them. Anything that, again, if you're going to work in the health profession, in any kind of health profession, having just a fundamental basis in Spanish and knowing some of that technical language is going to be so helpful.
Yeah. Well, Kurt, I mean, I don't have words to be express my how grateful I am that you're sharing your experience with us. But Maria Jose, she's the organizer of this event.
Oh, thank you. I think the feeling is mutual. I am so impressed also, and so proud of hearing you, because you have been so well articulated. You have touched so many disciplines. This is truly an interdisciplinary field, right? You talk about neuroscience, sociolinguistics, linguistics, Spanish culture. So it has been amazing. I'm so thankful. And the chat is on fire, as Dr. said. So many compliments, Kurt, about your Spanish, about how well you explain things, that you are an inspiration. And I think that you convey that passion about your profession. I can really tell that you love what you do.
I do.
Yeah, we can tell. So this is very, very motivating for all of us, and especially for the students. And I'm sure that they will be thinking now more about Spanish, about courses, about the Master in Speech Pathology. And that's what we want. We want to inspire people and to think critically and think about other career opportunities in Spanish. So thank you so much.
You're welcome.
It has been amazing.
I'm so grateful. I'm grateful for all these comments, and I'm just grateful for you guys. I'm so glad that, you know, this has been helpful for people. I will eternally be grateful to the Spanish department at Montclair, which became my home for so many years, and the linguistics department, which just gave me, again, all the fundamentals and just the relationships and friendships that I made there. I'll always be grateful to my undergraduate, my favorite undergraduate programs and my favorite professors at Montclair.
Thank you so much. And thank you everybody for joining us. This was Career Night We will have another episode of Career Night next month, but we also have a film forum. We have the virtual lecture series, and we have Ubisunt, which is another program connecting also with our alumni. So thank you again, and see you next time.
Gracias.
Thank you, everybody.
Gracias.
Thank you.
Muchas gracias.
Ciao. Ciao.
Bye-bye.
Bye.